Explosions and heavy gunfire rocked Sudan's capital as the nation entered its fifth day of fighting today. This comes after a truce between the Sudanese army and paramilitary forces fell apart. The United Nations says at least 270 people have been killed in the violence, but the death toll is likely much higher. CBS News foreign correspondent Deborah Patta reports.
A 24-hour humanitarian truce agreed to by both sides of the conflict quickly degenerated into this. Heavy gunfire peppered the capital, Khartoum, soon after it was supposed to have gone into effect. For 5 straight days, a city of over 6 million people has been turned into a personal battle zone where a power struggle between two rival Sudanese generals has exploded into all-out war. Half the hospitals are out of action, even as the number of those injured and killed keeps on climbing. Caught in the middle, civilians like Dalia Mohammed.
The last few days have been pretty much all of us just staying inside, indoors, and trying to keep our sanity intact.
The U.S. has urged Americans in Khartoum to shelter in place. And speaking yesterday, Secretary of State Antony Blinken said a clearly marked U.S. diplomatic convoy had been fired on. Nobody was harmed, but in calls with Generals Burhan and Hemeti, he said the action was reckless and irresponsible.
I made very clear that any attacks, threats, dangers posed to our diplomats were totally unacceptable.
The State Department has established a Sudan military conflict task force and says contingency planning for U.S. personnel in the East African nation are underway. Deborah Patta, CBS News.
For more on this, I want to bring in Abdalla Hussein. He works with Doctors Without Borders as the operational manager for Sudan, South Sudan, Somalia, and Liberia. That is a very large swath of the continent, Mr. Hussein. But your organization has called the situation in Sudan specifically, quote, dire. What do the people of Sudan need right now urgently?
So what is urgently needed is access of patients to care and access of humanitarian personnel and health personnel to assist this population.
Doctors Without Borders teams have been treating patients who were wounded. What's the latest in terms of numbers that you're seeing? What do they look like?
Well, it's really difficult to know the extent of the people who have been wounded. But for us, I can speak on Médecins Sans Frontières has supported hospital in North Darfur. In Al-Fashir is a place where a hospital that we have been supporting for some time now. It was a maternity hospital, but in the last days it has been receiving wounded people. Up to the last a number of people that I'm aware is over 200 wounded. Most of them are civilians, including children and women. They were caught in the crossfire when they were doing their normal business. And this population were coming to the hospital. One of the big constraints that we have is the medical staff to go to the hospital and assist these wounded. So wounded were arriving, but the staff were not able to go to the hospital. In the last hours, we were also running out of supplies. We have tried to resupply the hospital, to reorganize and expand it and repurpose it to accommodate the wounded patients, but as well as care of other patients that don't have any other hospital to go. In Al-Fashir, there is 4 hospitals. 3 of them has been closed. Either those staff fled, or they were looted, or some of them were close to the where the fighting was happening.
Mm. So, what difficulties is MSF facing in Sudan, and has there been any communication with either side participating in the fighting to at least get some medical resources, get medical attention to the people who need it the most?
You know, as most of the civilian population, our staff are stuck. We are initially stuck in the first hours in their residence. We still have staff that are trapped in different locations in the country. Just to remind your viewers, MSF was running medical programs all around the country before the violence. So we were already responding to a crisis, and this is a new crisis that added on the top of it. So we have our staff in different locations of the country, but what we try to do is that to stay in touch with hospitals in Khartoum, for example. We know that 50% of the hospitals have not been functioning. They are either bombed, or they were close to the place of fighting, or they don't have fuel and supplies. And so we try as much as possible to coordinate with the Sudanese authorities, the Minister of Health, for example, and try to identify hospitals that have needs and send. But it was really difficult for our team to move in the first place, just like the rest of the civilians.
What can we do to help? What can the international community do to help the civilians of Sudan?
The international community, what it can do is to scale up, to push for access, humanitarian access in Sudan, and specifically the parts to the conflict to respect the civilian population, especially the civilians that are in the urban places, which the fighting has been happening in the last days. We also need a respect for health facilities, but where the people, when they are wounded, the first place where they're going is a hospital, and if the hospital becomes a target, it makes the situation even way worse. So our call is to the parties of the conflict to respect civilians, to give access to health workers, and most importantly, to have a port of entry to the country where we can provide more staff with expertise who can deal with the situation on the ground. Today, our teams in Al-Fashir, they are dealing with the wounded, with the supply they have. But if we run out of the supply we have on the ground, we will be facing a situation where we will have more loss of life.
Abdalla Hussein, thank you so much. Thanks for spending time with us, and thanks for the work that you're doing.
You're welcome.